Hello, everyone, and welcome to the January 26, 2021 Provider Collaborative webinar. My name is Jessica Diaz. I'm your Provider Outreach and Engagement Coordinator here with the Community Partner Outreach Program, and I am so excited to have us all here today. Now, that slide moved forward on its own. Today, we're here to talk about a few different topics that all revolve around CAWM, fee-for-service, and the COVID-19 emergency period. So those are the thrust of topics we're talking about today. And I'm also very excited to have a few folks on the line. I'll be giving most of this presentation, but the real brains behind the operation are Napua Rich, who's the program manager, a program manager of a whole bunch of programs at the Medicaid Programs Unit, as well as Jennifer Valentine, who is an operations and policy analyst with the Health Systems Division. And then a little bit later in this presentation, Emily Ellman with the Reproductive Health Program is going to be joining us today. I do want to start out by saying that we are here with some answers. A lot of these are specific to billing. We will not have all of the answers. So please feel free to put information into our chat questions box and we will answer the questions we can, knowing that we will not have an encyclopedic knowledge of exactly all of the ins and outs of everything relating to the emergency period. So if there are answers we can't get to today, know that they will be recorded and we will circle back on the pieces we're able to. So with that said, we will be talking about CAWM billing during the COVID-19 emergency period, going into some detail on the new fee-for-service interpreter billing guidance that became effective at the beginning of January 2021. Some of the details will be specific to the COVID-19 vaccine and billing practices. And then the reproductive health part of just reintroducing some key facts about CAWM Plus, both within the emergency period and when we are outside of the emergency period. And then at the end, we'll hold some extra space for Q&A. If you have questions that come up along the way, please feel free to put them in. You do not have to wait until we stop for questions. I will, at a few points, stop for questions and double check the question box to see if there is anything that we can get to before we get to the end of the presentation. And we are providing this webinar to really help us have a shared understanding of how CAWM and the COVID-19 emergency period and these other moving pieces really fit together so that we can make sure that folks have good experience and really the same experience no matter which provider they go to about what they should expect to be covered. So during the COVID-19 emergency, the CAWM benefit level of OHP includes services for the diagnosis and treatment of COVID-19 across the board. This includes the COVID-19 vaccine, and so that is specifically covered under diagnosis code Z23, and so you should use that for billing. We want to make it really clear that this coverage is not limited to only emergency rooms or hospitals. OHP can reimburse providers for these COVID-19 services regardless of the service location, and that includes non-emergency settings such as medical offices, urgent care facilities, and at pharmacies. Providers can bill the Oregon Health Authority for COVID-19 related services provided on or after February 1st of last year. So starting February 1st onwards to now and into the future. If you have any questions or are having billing challenges, please reach out to our Provider Services Unit at 1-800-336-6016. We're not going to go through the entire Oregon Medicaid COVID-19 provider guide, but just know that many answers to questions you may have will be in this guide. including things relating to OHP coverage of testing, screening, treatment, and telemedicine services. Some pieces on OHP eligibility as it pertains to the COVID-19 pandemic, and other resources and information relating to billing and providing services during this emergency period. So if you are not familiar with this provider guide, I will send all of our attendees a copy of the slide deck, and this becomes a clickable link when you're looking at it in a PowerPoint, so that you can easily get there, but also know that it's pretty front and center on the provider page for OHP providers and COVID-19. Some of the specifics in the guide, it contains billing guidance for COVID-19 vaccine administration, and we're going to go over some of that today. Also talks about monoclonal antibody administration, and includes, and this is a topic we will return to in more detail today as well, the add-on fee for the cost of interpreter services for fee-for-service folks at covered healthcare visits. And then there is a specific section, just to reiterate, about eligibility as it is covered for CALM eligible members, and specific even down to the COVID-19 vaccine administration. And you'll see the document that I have here. I just took a screenshot of the most recent version as I was making this presentation, which is January 8th, 2021. Highly recommend finding the one that is up online, because it will continue to be updated as our guidance changes and evolves. So we're going to go into more detail about interpretation services for fee-for-service OHP members. Starting January 1st of this year, and right now through June 30th of this year, the Oregon Health Authority will pay an administrative add-on fee for interpreter services at any fee-for-service healthcare visits that are covered, including telehealth visits. This fee has been approved at the federal level through the Centers for Medicare and Medicaid Services, and is $60 once per event. If you are a fee-for-service provider, there are a few guiding principles we want to share with you. Please be sure to address the language needs of, oh gosh, did I have these acronyms spelled out and skip over it? Let me double check. I think I removed that part. LEP is limited English proficiency. Jennifer, could you help me with NEP by any chance?
Yes, non-English proficient.
Thank you. I didn't want to get that wrong. So non-English proficient and deaf or hard of hearing members. So the provider guide that I just showed you has guidance for how to adequately address language needs of these populations. In order to bill for this add-on fee, you can use these codes right here, CDT code D9990 for dental visits, and HCPCS code T1013 for other visits. And we ask that you keep documentation in the medical record that indicates the use of qualified or certified healthcare interpreters for any potential audit of services billed. So OHA will cover the interpretation services fee only when the following is true. The fee is billed in conjunction with a covered OHP service or medically necessary follow-up visit related to that initial covered service. The fee can't be billed in conjunction with bundled rate services that incorporate administrative costs. We have some examples here, including inpatient hospital stays, hospice visits, services provided by long-term care facilities. Now, I already see a question to clarify this services billed at an encounter rate by rural health clinics, fairly qualified health centers, and tribal health centers. So we have a question that relates to this item, which asks if an FQHC is allowed to bill for either of these codes? And I'm going to turn to Jennifer.
So this is Jennifer. So when the encounter rate is being billed, it includes an administrative cost in that pricing. So in that case, we are already covering the cost of the interpreter service. But any visit that an FQHC would bill that is not an encounter rate, which typically has been like if it's not at the a face-to-face visit, for example, and I would just refer folks back to their own Jennifer Smith or Jason Steiner, who are really the experts on the F2HCs, whether it be tribal or the other F2HCs. They're the policy analysts that can assist you on billing encounter rate. But in those cases where it's not encounter rate, then yes, it can be added on. But where encounter rate is just CMS has said you guys already account for administrative costs in the bundling of those services. So that's why it's not separate. But what we wanted to do is make sure that for everything else where we haven't bundled it into those services already, we can ensure that providers can bill that code.
Thank you so much. And then the last piece of the requirements in order to cover this interpretation service is that the language assistance service must be provided by a qualified or certified healthcare interpreter. And there is a specific Oregon Revised Statute to define that. I want to remind us all that providers remain responsible for ensuring that interpreter services are provided in order to ensure effective communication and billing OHA for this service. Federal Medicaid requirements do not allow interpreters to enroll and bill as Medicaid providers. So the addition of this add-on fee for interpreter services at these healthcare visits does not change any of the requirements for coordinated care organizations related to reimbursement of qualified and certified healthcare interpreters for interpretation services. And I'm not sure, Jennifer, if you have any more details on the requirements for coordinated care organizations when it comes to this. I know we have a memo that specifically goes into these requirements.
Well, we'll just say that CCOs have been required to ensure interpreters are used or utilized or engaged as professionals for appointments that are needed. So, so given that they already were doing it, the issue and they're paying for it, either the CCO has arranged or paid for it typically, or they reimburse the provider. So they have mechanisms already set up and have been doing that. And so if there's any issues for a member who needs it and is not getting it through the CCO, they would contact the CCO customer service to ensure that the CCO knows that that member needs that service. But for fee-for-service, we had not had a mechanism to pay providers. And so this is what this particular coding does, is open up billing to providers to help offset the cost that they have for healthcare interpreters.
Mm-hmm. Thank you so much. And I know that this is something that has been requested, and there have been a lot of open questions about this. I guess it's sort of been perceived as a gap when it comes to fee-for-service, as opposed to the folks who are getting their care through coordinated care organizations, because the requirement has always been there to provide adequate interpretation, but a mechanism to pay for it has until now not been a part of fee-for-service coverage. Is that correct?
Yes, and it's been something we as staff have been trying to work toward for many years. So we were very excited to be able to offer this at this time. We can also let folks know that there is a current bill in the legislature that's been introduced to make this a permanent. Right now it's being offered through the COVID-19 emergency waiver, but we have asked for the legislature to fund that on a more permanent basis. So we are hopeful.
Yes. I am hopeful as well. And in fact, this is a good segue into our final slide on interpretation services, which is just to sort of reiterate why this change has been put into place, which we're committed to ensuring that we are complying with civil rights laws and the OHA non-discrimination policy. And a big part of that is making sure folks do have access to the interpretation and other care they need. Providers and CCOs must ensure that all services preserve meaningful access to language services at all healthcare visits, including telehealth visits. This change will support the costs that providers incur for ensuring patient access to interpreters as required by federal and state law for limited English proficient. Here's our explanation of the acronyms. Limited English proficient and non-English proficient, as well as deaf or hard of hearing members. I'm going to pause us now for a second and take a look at our question box before we move on to our next topic. Okay, we have some good questions. Yeah, I think the intersection of COWM and the fee-for-service population is something that we've sort of had implicit in these slides but haven't said explicitly, which is that a lot of folks who are on fee-for-service for a continuing amount of time are COWM members, COWM Plus members, maybe folks who have other major medical. So we saw that the topic of fee-for-service interpretation and the topic of what falls into COWM COVID-related care really do go hand in hand. So the question is, everything we're talking about for fee-for-service interpretation, is that applicable to COWM visits and specifically to COVID-related COWM visits? And I believe the answer is yes, but I'll defer to Jennifer.
I set up the code, but I also defer to Napua, who really knows more about COWM. But as I understand it, we opened this up to COWM. So Napua, do you want to confirm that?
Yes, that's correct.
Awesome. Thank you both so much. So yes, this guidance that we are given is applicable to COWM visits. It's applicable to COVID-related COWM visits. And let me look to the next question. And is this also applicable for Cover All Kids visits? And I believe the
Yes.
answer is yes again. Thank you. So this fee-for-service interpretation new guidance applies to all fee-for-service OHP members regardless of their benefit level. So it includes Cover All Kids, COWM, COWM Plus, OHP Plus, OHP Pregnant Adult, all the way across the board, anyone who is on fee-for-service and needs interpretation for covered services. I hope did that adequately answer the questions, folks who are keying things into the question box. Let me know. And I did want to take a moment also to say that I have heard some confusion about this new guidance. OHP application assistance is not a covered visit. So this guidance, I do not believe applies to if you are helping someone navigate the OHP application process, because at that point they are not yet members and they are not yet on fee for service. I have heard some confusion about that. I do want to remind all of our provider network who are also certified assisters that if you lack interpretation tools for any reason in your position, we do have a Voyance shared contract, and I am happy to follow up and give you the details to access that. I'm not sure if I heard someone start to talk.
Jessica, this is Napula. I just want to make a clarification. So as far as the question for the CAC goes, just want to make it clear, the COVID immunization is only available to those who are 19 and over or 18 and over. So children in CAC, I apologize, would not be covered because that is not an age group that's covered for the immunization. I apologize for that.
Oh, that's a great point. Every step of the way for this, there are limits to what is covered when it comes to COVID-19 covered services. They have to fit in with our guidance on what is COVID-19. For instance, sorry, my sentences aren't coming together today, but the example that Nipua just gave, which if an immunization has a specific age range and someone is under that age, then they could not get that vaccine and it would not be covered if they were to somehow be in a position where they were offered it, which they should not be. So there are some times where folks may have something that is related to COVID-19, but if it doesn't align with, and I am not a medical expert, so I could not speak to those details, other than to give that vaccine example, the emergency use agreement for the vaccine does not cover children, which is why it is not covered for children. But if a child on Cover All Kids were to, for instance, have COVID and get treatment for having COVID, that would be covered, right, Nipua?
That's correct.
And then I have, let's see here. What information is required in the chart note to support the T1013 code? Do we have an answer for that?
Is that the interpreter services coding? They need to record the interpreter information that the documents that they had a certified or qualified interpreter. I believe there is also new legislation that has been introduced that would be more specific to that information that's required, but at the present time they just need to be able to point to that they used an certified or qualified interpreter and keep that in the medical record for that appointment in case of audit. And then, any information that verifies if it's not already in the OHP information that the member needs that service.
Thank you. And so I'm hearing that interpretation information as well as interpreter information to clarify that they are a certified or otherwise they fit into these requirements, as well as if it's not already in the case, the need for interpretation are the pieces that currently are required. Did I get that right?
Yes, I mean, and that can be really just be an acknowledgement that the provider is saying that the member requested it because of a need. So if it's not already not every member who needs interpreters actually tells us in their application that they do. So probably if you look at the records we have in MMIS for members, it's not an actual match. So we want to, make sure that that provider, it really, I don't think it's going to be an issue or anything. It's just a way to verify that. And then hopefully the provider has a mechanism also to set up any following appointments that they have put it into their medical records so that the member continues to get the services every time they have an appointment.
Thank you. I'm double checking. I believe I heard audio throughout that all, but at least one of our attendees lost audio. Do you mind if you repeat what you just said?
Just that we want the reason to put the information in the medical record again for the provider that the member has requested or needs an interpreter, or a family member needs the interpreter or whatever's meets that requirement. We know that it's not always an MMIS, and ultimately we want the providers to continue to engage interpreters every time that a member needs it when they come back for other appointments. So ideally it's documented there, and our auditors just, if they don't find it in MMIS, if they find it in the medical record, it's just another check that says the provider, had inquired about it.
Mm-hmm.
Best practices for providers are that anytime someone is setting up an appointment, they would ask for need of special services or language or disability access, including other disability access things like, do you need special equipment to, communicate during this appointment?
Hmm. Thank you. And then I think this is a very similar question, but I just want to make sure we are answering it fully. The question is, if a patient has an office visit and there is an interpreter involved, the interpretation code would be added to the provider's office visit code too and billed with the provider's billing info. Is that true?
Yes. So it's when there's another visit that's a covered service, that then they add and send it in as a combined, but they're billing for two services. We would never want to see the provider billing separately for just interpreter services. But whether it's a in office or it's a telehealth visit, you're going to bill for the service. And so yes, anytime that you're offering a service, ideally then you're matching up to billing. There is a limit of a service per day, or like when if you had an office visit and you had a vaccination, you're only going to get the interpreter code for the office visit, not also for the vaccination. So it's not going to be paid twice. It will be paid kind of once per provider or visit.
That's a great distinction, yeah, that you should never be billing this code on its own because it should always be with a covered service of some sort, and that you cannot double bill for different things that happen in the same visit and have that interpretation code in there twice.
Right. And the system will only pay you once. So for that visit, they'll assume that the other one is, but if you went to, if a member's had a primary care visit and then they had a behavioral health visit in the same office on the same day, as long as those are billed as separate visits, separate providers, then yes, the interpretation for both appointments would be able to be billed.
Thank you so much. All right, I think that we are ready to move on, but I just want to hold some space. Napua and Jennifer, is there anything else you'd like to say specific to interpretation services? We're going to change gears and talk about the vaccine a little bit next. And then also, of course, if folks want to put things into the question box as they come to mind, we will return at the end of this session. But I just want to make sure we don't blow right past any questions. So I'm going to double check one more time and we'll move on.
I have nothing more on interpreter services, but I would like to add that Jennifer has done a great deal of work on this, and I'm so thankful that she was able to get that through.
Yes. It's funny. It seems so cut and dry and straightforward in these slides, but so much passion and work and effort went into making this happen. And that is something that is so important to recognize.
And now we just encourage folks to contact anyone they want to encourage this bill that will make it permanent to go through so that we can continue it.
Yes, thank you. All right, I'm going to move us forward. All right, we're going to talk a little bit about the COVID-19 vaccine, and I will start by saying we're talking specifically about billing for two specific vaccines, which is the FDA-approved Pfizer and Moderna vaccines. So OHB covers the administration of COVID-19 vaccines as supplied through providers through allocations from the federal government. We will continue to update our guidance of any additional products that receive FDA approval. So just know right now we're just talking about Pfizer and Moderna, but there will likely be more to come soon. So right now we're in the process, and I believe this is still accurate. I don't think I've heard new news, to increase our rates for the COVID-19 vaccine administration with the federal government. The fee-for-service program rates for this service are listed below. You'll see these codes 0001A, 002A, and 0011A, 0012A. You'll see that the Pfizer and Moderna vaccine administration first doses and second doses, so it does not matter which of these vaccines it is, the prices are the same. We expect it will be this rate of $16.94 for that first dose and $28.39 for the second dose. I think, Nafua, that there's no change on the federal approval as of now, right?
Not that I'm aware of.
Of course, knowing that everything relating to this pandemic can change at any time. So we'll let you know as things get updated. But just know that if for some reason that federal approval is not met, then the rates would be a bit lower at $11.86 for the first dose and $19.87 for the second dose. And actually, I just want to double check. So this is very specific to vaccine reimbursement and billing codes. So I'm going to hold for a second to see if there are answers. And I do want to answers. There are answers if there are questions. And I do want to say that no matter what someone's coverage or lack of coverage is in Oregon, everyone should be able to get the vaccine at no cost to themselves other than potentially a small administration fee for folks that are outside of OHP. And COWM does cover the vaccine. COWM, COWM Plus cover all kids. OHP, all benefit levels cover these vaccines. And a quick note that I will make sure to put these slides up on group site, and that once the recording is available, it'll go out to all of our providers as well.
Jessica, I just want to be sure that we're really clear about COWM, and COWM needs to have a diagnosis code of Z23 in order for our system to pay. I know we said that in an earlier slide, but I just wanted to reiterate that.
Oh, thank you so much. Yeah. Can you talk a little bit more about this distinction so that we're all on the same page?
Sure. There are other immunization administrative codes, but for the administration of the COVID vaccines, in order for our system to pay, we have to use the Z23 diagnosis code as of now. That could change, and if it does, we would definitely put that information out there. But our system is set to pay emergency only for COWM recipients. And so we needed to do some special configuration in order to allow this to pay through our MMIS system. And in order to have that happen, it has to include the Z23 diagnosis code, which is the administration code.
And is that just for the vaccine, or is that for any COVID-related COWM coverage?
That's a great question. That is just for the vaccine administration, and that is a vaccine administration diagnosis code.
Thank you. To double check for questions. We have one. Does Z23 have to be present on the claim or primary? I'm not sure I know enough to say that question well.
Sorry, my phone was giving me a hard time getting off of mute. I apologize. It needs to be primary.
Okay. So primary, not just present.
Correct.
Okay, I'm going to move us ahead, but know that if questions come up, we will make sure that we return to them. Oh, wait. A sudden flurry of questions has arrived. Let me... Okay. If a COWM member goes into an office for a COVID visit, how will the billing system know to override for the COWM denial? And I assume this means outside of the vaccine specific question. Do we have any advice on that?
So we have set it up based on the coding. So we have specific COVID codes. So for the COVID testing, there are specific codes, and for treatment, there are specific codes. And we have set up our system to be configured to pay that. So it will override. If there are any issues with billing, please contact our provider services unit so that we can get your questions answered and help you work through your billing issues.
And are some of those details in that COVID-specific Medicaid provider guide?
They are all there. Everything that needs, yeah, it's all in the guide.
I can try to pull that up at the very end, just so we can at least look through the table of contents really quickly. I think we'll have a little extra time. So that's something that we can do, because a lot of these questions are specific to those diagnosis codes. We have a specific question about the serum code. So will submitting the serum codes at 0.01 cause claim issues? And let me know if we're getting too weedy and we have to circle back later. I do want to reiterate, yeah, Z23 is for the vaccine. There are other codes for testing and treatment, and I don't know them off the top of my head. And then we have some advice, which I am not an expert to know if this is good advice or not. So I'm going to read it and we'll see if Nipu and Jennifer have answers, or else I can go chase them, which is on Ocean Epic. This person uses a generic Medicaid pair, and then billing staff manually enter the claims into MMIS. I think that may depend on what your role is, your role in the process of billing for services.
Yeah, it sounds like something very specific to a particular medical record, and I'm sure if your staff leadership has told you how to bill for Medicaid, that they can answer your questions, to ensure your coding goes in. But but essentially, yeah, we're not involved in that process.
Yeah, I'd say if it's working for you, that's awesome. And I don't know enough to know for whom that will be helpful or not. But I think that we have a few open ones just about those diagnosis codes. So we'll circle back to that at the end. And I want to make sure we give some space to Emily, who is going to be up next. And Emily, are you? Hi, welcome.
Thank you. Thanks very much. My name is Emily Ellman, and as it says on the slide, I'm with the Reproductive Health Program in the Public Health Division. And I want to thank Jessica for giving me a little bit of time during today's webinar to slide in and do a bit of a refresh around some coverage related to reproductive health for the CALM eligible population. We can go to the next slide. So some of you may remember that back in 2017, the legislature passed the Reproductive Health Equity Act, and it had a number of provisions in it. It was a very large bill, but for the purposes of today's discussion, the two most relevant are the expansion of medical coverage 60 days postpartum for CALM Plus population, and then also new coverage for full range of reproductive health services for essentially the CALM eligible population. And this is how it's written in the bill, and it's kind of wonky, but it's for individuals who can become pregnant and who would be eligible for full OHP if not for their immigration status. So I'm going to go into just a little bit of detail about these specific benefits. If you can go to the next slide. So, and again, this is something that you may already be aware of, but in 2018, as a result of the bill, state funds were provided to expand Callum Plus coverage for 60 days postpartum. Prior to that, as you all may know, coverage ended the day after delivery. And so this is full medical care, including dental. It's regardless of how the pregnancy ends. It includes, as I said, full medical care and dental, immediate postpartum tubal ligation, LARC insertion, and providers just continue to bill, as they always do, fee for service for these services. One of the other things, and actually the conversation that Napua was just having about adding some specific codes for COVID-related services for Callum reminds me a bit of the work we had to do, and Napua did a lot of this, around adding tubal ligation services to Callum through the use of REA funds. And so as part of this bill in 2018, tubal ligation, female sterilization services were added for individuals eligible for and enrolled in Callum. And so immediate postpartum tubal ligations became available under the Callum Plus postpartum expansion, and tubal ligations became available under Callum outside of the postpartum period. And as I mentioned, individuals must be enrolled in Callum to access services and can go to any OHP enrolled provider for these services, the provider or facility, and the providers would bill fee for service as they do with other Callum covered services. And a reminder that tubals, voluntary tubals, require the client with their provider to complete a sterilization consent form at least 30 days before their procedure. That's a federal law, and that is true with tubals under OHP as well.
I do see a question on your last slide, which in full medical, does that include specialist visits when it comes to the postpartum period?
My understanding, and if Napua is still on, she should chime in because she is really the Callum expert, is that whatever is covered under Callum Plus in the prenatal period is continued through the postpartum period. So it's the same benefit package. But I'm going to let Napua either correct me or confirm.
That's correct. Thank you, Emily.
Thank you so much.
Okay. And around the time that this coverage was put into place, a document with billing guidance for tubal ligations was created by the folks in HSD. And I think it's incredibly helpful because it explains or it lists the codes, both the diagnosis and CPT codes that are covered when billing for Callum clients for female sterilization services. And I think if Jessica hasn't already shared that, I believe she will, so that you all will have that as reference.
Oh yes, it's in the handout section of this webinar, but I'll make sure it also gets sent out after the webinar to everyone who's attended today and
Great.
put on group site.
Great, thank you. And then I want to spend just a minute giving a little bit of a plug for services available outside of Callum and Callum Plus for this same population. And so if you can go to the next slide, I'm going to do a brief plug for the program that I work in, which is out of the Public Health Division. And we have a certified network of providers across the state. They're comprised of local public health departments, Planned Parenthood clinics, FQHCs, school-based health centers. And these certified network of providers adhere to high quality national standards of care, and then we reimburse for the cost of services that they provide. So if you go to the next slide, we have funding, and part of our funding comes from the same Reproductive Health Equity Act fund to support the provision of free services, reproductive health services for the COWM Plus kind of eligible population, right? If they're outside of the COWM Plus postpartum period, or they are seeking reproductive health services outside of tubal ligations, we offer coverage for free services. And they simply would walk into one of our clinics, complete an enrollment form, and be able to receive free services and birth control supplies the day of the visit. And you can see on this slide what the eligibility criteria is. And because of RHEA funding, Reproductive Health Equity Act funding, we are able to cover folks regardless of their citizenship or immigration status. If you can go to the next slide. These are just some examples of services that are available. And one of, I think, the key features of clinics that participate in our program is that they're required to dispense birth control at the clinic site, so that there's no need for someone to have to make a second trip to a pharmacy. And the next slide. And as I mentioned, we have a network of clinics across the state. If if you or your clients are interested in finding out more about where those clinics are, they can reach out to 211 or visit our website. And individuals don't need a referral. And again, as long as they're at or below 250% of the federal poverty level and of reproductive capacity, so able to become pregnant or get someone else pregnant, they can enroll and receive free coverage for the services that I listed a couple of slides ago. I think that is it
Oh,
for
yes.
me.
I have a little bit to tack on to that update, which
Great.
is just to reaffirm for all of us here that during the COVID-19 emergency period, the COWM Plus level of benefits is not ending after that postpartum period. It is continuing with that COWM Plus level of coverage, including expanded vision and dental care. At this point, until the COVID-19 emergency period ends, we expect this to continue. And so that's my little update that I'm tagging to the end of Emily's presentation. But I do also want to hold some space for any questions and any thoughts that our attendees may have about this topic, which is COWM Plus and reproductive health. And while I wait to see if anyone has questions in the question box, I do want to say that we have had instances where providers don't seem to be aware of the postpartum period, even though that change is not that new anymore. And we definitely want to make sure providers are aware of the ramifications of the emergency period for this population as well.
And this is, as we wait for questions, this is Emily again. One thing I wanted to mention, which is not on the slides, is that Reproductive Health Equity Act funding also provided coverage for abortion services for COWM eligible folks. And we in the reproductive health program contract with abortion providers to offer this coverage. And so again, an individual who doesn't qualify for OHP because of their immigration status, full OHP, would just need to go to one of the contracted abortion providers and complete our enrollment form and be enrolled and able to receive coverage for the abortion services. And we have that information on our Find a Clinic page as well.
Oh, yeah, and I'll just go back to that page as our resting page so that people have that information. Let's see, we have a question specific to the COWM Plus COVID-19 emergency period. And at this time, my understanding is that that continuing coverage is throughout the full duration of the COVID emergency period. And I know that that is something that is determined federally, so we continue to get updates on that as well. And I would not be surprised to see it continue to be expanded beyond, I believe March is currently the quote unquote end date of the current emergency declaration, but it likely will be extended further. And then we have a question just asking to reaffirm that dental services are also part of the Callum Plus and Callum Plus postpartum coverage. The answer is yes, I believe. I realize
Yes,
there are a lot of
that's
experts in
correct.
the room. Thank you, Napua. So
You're
yes.
welcome.
And a question, does that include oral surgery? Oh gosh, questions coming in. I don't know the details about oral surgery for Callum Plus folks.
Jessica, I can help with that. So anything that would be covered for an OHP recipient, other than those couple things that are not covered under Callum Plus, are covered. So if it would be covered by an OHP recipient, then it would be covered by Callum Plus, unless it is one of those few things that we do not allow. So it's really dependent on the billing and what is allowed in the general population.
And then the example that this community partner was asking about was wisdom tooth extraction.
If it's covered for the general OHP population, then it would be covered for Callum.
Mm-hmm. And I have to say, I don't know the ins and outs of everything on the covered list for OHP Plus benefits, but there is the list of benefits available online, and then provider services can help you with details as well. Let's see here. Here are some questions about that extension of the emergency declaration, and I have to say, I find out at the same time that the public finds out when federal guidance changes. So we will do our best to keep our network updated as we learn more information, but we don't have any special knowledge of what's going on at the federal level and that emergency declaration through FEMA. Let's see here. And Calm Plus postpartum covers vision as well. Yes.
Jessica, vision services is extremely limited, even for the OHP population. That's also my program. Just wanted to say that because if it's specific to CAC, then yeah, it would be covered. But you must have a specific diagnosis in order to have your visual services covered during your Calm Plus period.
Now, if I might use this forum to educate myself for a second, I was under the impression that the pregnant, like the PWO of OHP Plus, the Pregnant Woman Program, also known as the Pregnant Adult Program, has expanded vision just like children do. Is that not accurate? And is that not accurate for Calum Plus?
That is not something that I am aware of.
I will go digging for answers more soon. Actually, here's a great question, which is if someone is declined services and they are on Calum Plus, is there a number to call or a best practice for how we can help folks get the services that they should be able to get?
So Jessica, anytime that any provider is having difficulties with claims, they should certainly get in touch with our provider services unit.
Mm-hmm.
And if our provider services unit is unable to answer their questions, they will reach out to the subject matter expert to assist with that.
And I will also offer, feel free to either, like if it's an email, you can CC me, or if you're not sure where to go, you can definitely reach out to me as your provider coordinator with the CPOP network. And you all will be getting an email from me afterwards with these materials, so you will have my contact information to do so. So if you are, especially if you are seeing trends in folks who are having, they're not getting what this webinar is leading us to believe they should be qualifying for. They're not getting those services, they're being denied or unable to set appointments, things like that. We're happy to work on that. And by we, I mean me and provider services. I will involve them. But also if you have connections with provider services that are working, I welcome you not to make me be a middleman if I would just be another step in the way. So that's a distinction I'll give there. We have some questions specific to the reproductive health program, and I would recommend, so for the distinction between what is covered for COWAM Plus versus COWAM versus the larger population, and I will go back to this slide that falls into these eligibility criteria. I highly recommend going to this website right here, the www.healthoregon.org/rhclinics, to find more details and to find clinics that would be able to offer the whole host of those services. Emily, did I do that justice?
You did, and I think that's a great recommendation because these clinics are all OHP providers. So, you know, the question by Georgia or from Georgia is a really good one because we have great coverage, but it's a patchwork, right? And so people are, particularly the COWAM eligible population, they're kind of moving in and out of coverage depending, you know, perhaps on whether they're pregnant or they've delivered or, you know, have in non-COVID times reduced from COWAM Plus to COWAM. And then we have the addition of our program, right? So it is a patchwork. But what I can say is that all of the clinics that are contracted with us, they are also OHP enrolled providers. And so if someone happens to have COWAM Plus and is still in the postpartum period, they know to bill COWAM Plus. If someone doesn't seem to have any coverage for whatever reason, or they're only enrolled in COWAM and are seeking a service other than tubal ligations, then they will enroll the client in our program and coverage. So I think it's just important to know that between COWAM, COWAM Plus, and RH program coverage, individuals are sort of supported throughout their reproductive years.
Thank you, Emily. I think this was in our, I just want to restate this question to make sure we're all on the same page. For tubal ligation, that's not only COWAM plus postpartum, but it has a different pathway if someone is COWAM versus COWAM plus?
No, I mean, actually, from the provider's perspective, if someone is either enrolled in COWAM Plus and is in the postpartum period or has COWAM only, the provider can bill for tubal ligation services even if the client is outside of the 60-day postpartum period, and can bill fee for service to get that covered. Regular COWAM or you know, COWAM emergency, if you look at the billing guidance document that is attached as a handout, it kind of walks through how if someone doesn't have COWAM Plus but is enrolled in COWAM only, how the provider can bill for those services.
Thank
and
you.
I will just reiterate that I know this is confusing, and so people are free to reach out to me. Jessica included, I think, my contact information. And if I don't know something, I go to Napua, and she inevitably knows the answer. So between the two of us, but you can definitely reach out to me directly.
Thank you. And let's see, we have one more question that's specific to that COWAM emergency room and then needing a step that is with a specialist next. So if that specialist does not work at the hospital and is called in, would the visit from the specialist be covered? And I believe that may depend on exactly what the service is. But for Callum folks needing to see a specialist, I hesitate to answer this without having specific details on what kind of service it is and whether that would be Callum covered. Goodness. I may have to come back to you, Alex, with more information later. And I'll give a quick note that Emily just said she was happy to be contacted, so I'll make sure her contact information is front and center in the email I will send afterwards. I would say probably to reach Napua or Jennifer. I'm a great person to talk to first. Maybe I can help you out or refer to these very knowledgeable subject matter experts who have taken the time to hang out with us, and I'm very grateful for that. I am going to go through a few more resources and then we'll see if more questions have popped up. So let me click on forward. Just want to run through a few resources for our OHP providers, which is when you get this in your inbox, all of these will be clickable links specific to like the entire provider guide as well as COVID coding. If you want to take a look at the nitty-gritty behind the federal and state changes and waivers and temporary rules, we have a whole list of those. As per the provider guide, if you have questions during the emergency, we do have a COVID-19 specific email address that is staffed to help answer your questions. I did also grab a few vaccine-specific resources here. We have vaccine information for providers as well as a toolkit to help you with communication. We have our vaccine advisory committee too, and so if you want to learn about what they've been up to or get updates from them, we have the link here, and then just general information about the COVID-19 vaccine. And just in case anyone has any questions specific to enrolling as a vaccine provider, we do have a specific email for that. And they may be able to answer some of your other COVID-19 vaccine questions. And then also to let you know, and sort of this is just a refresher, we do have OHP certified community partner resources as well. On January 12th, we did an update on the COVID-19 emergency period CP module. So a quick run through of things you need to know with your community partner hat on about those different eligibility rules and a little bit of things like telemedicine, that the vaccine is covered. So a little bit of overlap with this conversation today, but a lot of very specific, really great information. And that has been recorded and is up on group site. You know what, just for good measure, I'll make sure I link to it in my email as well. So we did that update very recently, a couple weeks ago. We do have a remote OHP assistance guide, so how to help folks remotely. And we are working on a pandemic income specific guide. So that is something that is currently going through our policy folks to make sure we are offering you up to date and good information on how to help people report their income accurately, because it isn't all intuitive and we want to help make that process better. So all of this information is or will become available on our group site. If you are an OHP certified community partner, you should have access to that group site. And if you do not have access, feel free to let me know and I will get you access. And we also want to reiterate that we have a variety of COVID-19 webinars, listening sessions, and other opportunities to learn and to share. That includes COVID-19 information sessions for organ health care providers. That happens the second Thursday of each month. I believe it used to be a couple times a month and now is once a month from 12 to 1. The next one is scheduled for February 11th, and then you'll see there's one each month moving forward. And there's also a Project Echo set of sessions for clinicians, and that is looks like it actually might overlap a bit now with our OHA provided ones. So I'll double check on this. But that is also available and hosted by the Oregon Echo Network at OHSU. And both of these can be found on the main COVID-19 provider page, but there are also links here. And then we just want to continue to let you know, just remind you that we do put all of our events up on the group site calendar. So if you're ever not sure what's on the horizon, if you have a specific population you want to learn more about, or you want to attend a regional listening session, we offer a lot of these in English and Spanish. The migrant seasonal farm workers one, I think the next one is tomorrow, and that's an excellent webinar as well. So there's a whole host of opportunities to both learn and to communicate with us if there are things that we are not, things that maybe are not on our radar or you're worried we're not prioritizing. We really do value our partnership, and we want to make sure that you feel like you are welcome to reach out to us if there's ever anything around OHP or COVID-19 that you think our team and OHA more broadly needs to know about. And just to let you know, this has been the second provider collaborative webinar since I have taken on this role. We offer this quarterly, and we focus on various topics of interest with OHP providers. If there is something that you want to learn more about, or if there is anything at all that you think others may need to have more information about, please do not hesitate to reach out to me. My email address is here, but as I said, I'll also be bothering you shortly via email, so you'll have it either way. No need to scramble and write it down now. And I believe an upcoming topic that maybe next quarter, maybe a little bit later, is our clinical friends over at the Health Systems Division have some content on helping folks successfully navigate the online portal to do prior authorizations. And so we wanted to offer that guidance as well as some other topics adjacent to that. So that is something that is likely going to be the next one, depending on how the calendars all work. And I am always looking for more things to learn about and to help spread the word about to our provider network. I don't have it on this slide, but also I do have my monthly provider email that goes out. So I grab all the hot topics I can find and sort of collate them and put them together for you. So I hope you all are finding that useful. And if there's anything else that you need, you do not have to wait until there is a structured time or a mass email. You can always reach out to me. I am here for our providers in our Community Partner Outreach Program network, and really excited to get to work for you all. All right. This is my final slide. So I'm going to stop talking for a second and look to see if there is any information, any questions that you all have now. And to once again also profusely thank Emily, Jennifer, and Napua for being excellent resources on this webinar for us all. I will reiterate that I'm going to send, here are the things that I'm going to send to you all after this event. I'm going to send this slide deck. I am going to send the COVID-19 certified partner update, which has information about eligibility changes through the emergency period, and also some guidance for how to best remotely assist folks and other pieces like that. I will send Emily's contact information, and then just know that if you need Jennifer or Napua's expertise, I'm happy to bring items to them. Just feel free to send them to me. And make sure that the handout that is here in the handout page is included as well. Oh, and the thing that I promised was to take a look at the provider guide with you all. So I'm going to open that up now. Looks like we might have done such a good job of answering questions in the earlier pieces that we may not have a lot popping up right now. So I'm going to go ahead and end the slideshow. Oh, by the way, here is that document that Emily was sharing about. I'm going to leave that visible for a second while I pull up the other guide for us.
Jessica, this is Napua. While you're pulling up that other guide, I wanted to, I'm looking at the questions here, and I see a lot of questions around the emergency CALM program and what's covered and what is not covered. And I just want to make it clear that these are covering emergency services, and the emergency services defined for CALM is very different than the prudent layperson definition. So it really is dependent on criteria, diagnoses, CPT code for those coverages. And those questions can always come through the provider services.
That's a great point. Thank you, Nipua. All right. Let me, oh gosh, this is teeny tiny. Let me fix this. So I have pulled up the Medicaid COVID-19 provider guide. You'll see there is a table of contents. We did talk about that requirement to provide culturally and linguistically appropriate services, so there's more information here. I'm going to click over to services where we start to look into codes specific to different covered services. So vaccine administration is first, and here's that information we shared today. Ooh, that jumped down. We have lab tests. Which include viral testing here. And I'm not going to read these all out loud, but just show you that they're in here so you know where to find them. Followed by antibody tests. Oop. Sorry, let me make this a little more readable for us all. And then there's also a list to the HERC's full novel coronavirus diagnosis and procedure codes, which will have a lot more codes specific to COVID-19 treatment. Just going to scroll through a couple more of these pages just so you know what kind of things are in this tool if you haven't used it yet, or if you haven't checked it recently, because it continues to get updated. In fact, look, there's already a newer version than the one I took a screenshot of. So we are updating things pretty quickly. You can tell I made my presentation right before January 22nd. And then in fact, I'll go back up to the table of contents just so we can look through that very quickly. And I see some questions are up. I know we've definitely had questions about medical transportation, so there's a section here devoted specifically to that. And then we have our eligibility section, our prior authorization section, and then let me click it down to billing. Which this looks like it's essentially a summary of the sections we were looking at up above. That's handy. So if there's anything that you can't find in this document, feel free to reach out. I will reiterate that provider services will have answers faster than I do, because I would then be asking provider services for this information. But that if you ever get an answer you don't understand, or maybe if you're worried things aren't being consistently understood across your region, I'm happy to step in and help however I am able to. I'm going to take a look at the question box. Can you clarify what email address to submit an appeal to? And did that change? And is that an appeal because a service was considered not covered and you believe it should have been? I'm not sure I have an answer to that off the top of my head. I could go hunting for it in this guide. Those of you who are OHP providers probably are much more familiar with this process than I am, but I do not have answers at my fingertips. Well, it's probably somewhere in this 39-page document, but I'll take a look to see if I can find where specifically that is. I have definitely been hearing about folks who are on Calum Plus and are having trouble with getting their prescriptions filled. I would say if you have specific details, you can send that securely my way. And we have had a few of these situations that our fantastic Medicaid folks over OHA have helped us tackle on a case-by-case basis. So I'm happy to help that happen. And then, yes, so this document is linked multiple times within the PowerPoint we just gave. And for good measure, I can send you this link directly, this one up here, because this link will take you to whatever is the most recent version of the provider guide, as opposed to if I were to send you the PDF on its own, it could become out of date in a day or two with the way that things are continuing to evolve and change. I do very much like how this guide has been put together because it's very easy to get to the different sections. And I think we might be at the end of this webinar. We held 2 hours just in case we needed it, and we're coming in at just under an hour and a half. So excellent job, everyone. You asked really great questions. I know there are a few that are still open questions. You're always welcome to email me to remind me. I get a lot of emails. I get a lot of phone calls. I would say for me personally, as your provider coordinator, emails are better than phone calls because I have an extremely small voicemail inbox, and so it gets overwhelmed very easily. And if you're ever concerned that I have not responded to you in a timely manner, I never take offense at being bugged a second time, and I try my best to be as available as possible, knowing that there are a whole lot of providers within our network. I think about 80% of our certified community partners work for an organization that bills Medicaid, so that makes you provider assisters. And I do work across the state, so your regional outreach coordinator is always a great resource as well. But if it's something that's specific to things that might be in MMIS or outside of the one system, I'm always happy to be a resource for you all. I'm going to reiterate one more time that we have been really lucky to have very knowledgeable folks happy to be subject matter experts and presenters today. So Emily Ellman, Jennifer Valentine, and Nupur Rich, thank you so much for being here today. We will make sure that this recording gets uploaded. I also want to apologize. Some past ones are on a backlog right now, but we are working through those. So expect more recordings soon. And join us next quarter for our next Provider Collaborative. Thank you all so much.